Hi everyone, this is Tim, your lecture instructor for the RN or the paramedic to RN transition program. And I know I already did a cardiac PowerPoint, but I found this one on heart failure and I thought it was pretty interesting. And it's pretty small, so I thought I'd actually do a little voiceover for it. So heart failure, it's systolic heart failure is the heart cannot pump enough blood forward. With diastolic heart failure, the heart does not relax in between contractions. So the way I think about it is that and I mentioned this in the other PowerPoint, is that right-sided heart failure, the heart cannot pull the blood from the extremities back into the heart and then back into the lungs for oxygenation. With diastolic, it can't relax in between contractions, so it really can't pull it from the lungs and actually pump it to the rest of the body. When the heart does not pump enough blood, hormones are sent to increase the amount of work that the heart does. And this is to, you're based on trying to create homeostasis. Your heart will speed up in order to try to compensate for the lack of. And then because it is a muscle and it's working so hard, it will eventually grow bigger. And that's where you get the cardiac hypertrophy. And again, this cannot continue for very long, and it will tire out, and eventually that's when you have cardiac arrest. Causes could be coronary artery disease, a heart attack, high blood pressure, heart valve disease, heart rhythm problems, heart muscle disease, alcohol or drug abuse. Signs and symptoms are rapid weight gain, shortness of breath, swelling, and fatigue. The rapid weight gain is more from the fluid that's being held on and collected throughout the body because the heart cannot circulate it fast enough for it to actually be processed for the fluid to come off, especially through the kidneys. Shortness of breath is because it can't be pulled from the lungs, or the circulation from the lungs back into the heart is not as great, so the fluid builds up. And swelling is for the lower extremities, actually, from the fluid building up altogether. And then fatigue is because your body really is just tired. You can't breathe well. You have all this weight on you. Your heart's not working right. It's not actually pumping all of what it needs to throughout the rest of the body, and it causes fatigue. Interventions are from the nurse, or what things that you should be doing daily is weigh your patient daily, same time every day, no clothes on, using the same scale, and actually logging the weight. The reason why is because if you weigh them different times of the day, they'll actually weigh differently. You want to weigh them at the same time every day. So you also don't want to use clothes because of the fact that that will actually add to the weight. Use the same scale because not every scale in the hospital is actually calibrated correctly, and you want to actually log it because if they're gaining weight, then they're actually retaining fluid, and you have to be able to do interventions to be able to correct that issue. Measure blood pressure and heart rate, log that daily. Follow a low sodium diet, cook without salt, and that's just because obviously water follows salt and you're trying to get that fluid off. Watch for sodium-rich foods, which are canned, seasoned foods, pickled foods, and meats. So for your patients, you not just teach them not to salt their food, but look for things that actually have extra salt in them. And canned foods are probably the biggest thing because they're full of preservatives. Give the patient other options for food choices. So, and you'll hear me mention this in class and lab and in other PowerPoint voiceovers. Um, you can't tell someone whether they're diabetic, whether they have CHF, whether they have renal failure. You can't tell someone who has lived all their life a certain way to all of a sudden stop doing those things because one is just not feasible to them. It's like telling a smoker that has smoked for the last 50 years to stop smoking right this minute, and they do. You have to be able to either wean them into it, you have to educate them, you have to be able to let them, fumble a little bit in order to get, go back on track, and you have to give them other options, because if you don't give them any options, they don't know what else to do. So for patients with congestive heart failure, again, what you're really trying to do, or your goal is to actually keep the water weight off. And if you're trying to teach them healthy habits for eating food or making food, and they have to be low in salt, then you have to give them other choices, or give them some other options, because if not, then it just won't work. Limit the amount of fluids. Again, you're going to teach your patient that if you drink a gallon of water a day, it's going to just be retained and it's not going to go anywhere. So you have to kind of explain to them, we need you to only drink a certain amount of fluids a day. Break it down into hours, break it down into half days. Give them options, give them reasons, give them, ways to be able to make it manageable. Because if you told me that I can only drink 1,000 cc's a day, and I drank 1,000 cc's that morning, could you possibly go 24 hours later without any fluid? You can't. So make it realistic. Also reduce or no alcohol. And again, this is really more because the alcohol itself is dehydrating to the body. And yes, we do want the patients to be a little bit dehydrated because of the fluid, but in the same sense too, it's not actually working well with their heart. Other interventions, you're going to give your patients medications, whether it be the Lasix or aldactone. You may actually give them cardiac meds that will allow their heart to beat more efficiently, or you may actually give them medications that have a combination of blood pressure medication and a water pill together. Teach your patient about what they are taking, the name, the strength, how often, and the purpose. You'd be surprised at how many times you ask patients, what are you taking for, CHF? And they say, well, I take a blue pill every morning, and it's in my little cup, and they're all split up daily. And it's like, well, it doesn't tell me what it is or what the milligrams are or what exactly it's being used for. And certain meds are actually multi-purpose. So blue pill doesn't really help us. Set up a schedule for them, make sure that they do have some sort of pill box, make sure that they're individually, marked out, and that way they can, take them at the same time every single day, and that they're not either taking too much or that they forget. Especially with cardiac meds, I mean, you take one pill too many times and it essentially could do bad things. Make sure they have their prescription refills. Make sure that they have at least a week or so in advance, so that way they don't run out, because there's nothing worse than running out that night and it's the weekend and they can't get it filled again until Monday. So patient with CHF, and you're trying to keep the fluid off and also make it their heart beat a little bit better and more efficient. Run out of medications and then they've screwed up. Also think about the cost. Again, these medications are very expensive, and some people have insurance and some people don't. Some people can afford it and some people just cannot. So you have to make sure that they can afford what they're being prescribed and that they actually take it and that they're compliant with it. Other things to think about, patients that are traveling, intimacy, emotions, coping with stress, setting realistic goals, advanced medical directives. These are all things to think about, because these, again, as I mentioned in other PowerPoints, this is not something that, one, you're going to cure, and two, this is also something that didn't just happen yesterday. It's happened for a very long time, and now that they're full-blown congestive heart failure, and a lot of things in life have to actually stop, but you have to be able to give them, other options, realistic goals, help them with stress. You still have to get them through it, and they still have to be able to try to live as much of a normal life as they possibly can. The advanced directives, especially the power of attorney, living will, and DNR. I mean, your patients should be having talks with their families about these things, especially when they start having chronic illnesses that could potentially lead to death. And that's because you don't want to wait till the last minute, and dad's confused and you're not really quite sure what he wanted, and you've got 5 kids fighting over everything. So promote your patient to be able to talk to their families about what their wishes are and what they would like to do in case something does happen. That's it. So it took me 8 minutes, and like I said, I just wanted to run through it, give you some more ideas about CHF and interventions, and we'll go from there. So let me know if you have any questions.